Right. So here is your stem.
Okay, 54-year-old lady admitted with the diagnosis of mild diverticulitis. As her symptoms become improved with the assessment of intravenous antibiotic, she complains of sudden onset of acute severe lower limb pain and examination. ECG-AF was broad periventricular. The AVG shows cirrhosis by the canal.
Sorry, doctor, I have to go. Sorry.
Okay, go. Thanks.
Okay, doctor.
All right. So if you've read and understood, considering good communication skills station, please begin.
Hello, I'm Dr. Mustafa SHO. I'm working for Mr. Man in EXO Hospital. I'm calling to speak to the vascular consultant. Could I confirm that I'm speaking to him, please?
Yes. Speaking to vascular consultant, please summarize your case.
Okay, thank you for the time, doctor. Okay, I have a female patient. She is 54 years old. She was admitted with us with diagnosis of mild diverticulitis. Her symptoms were improved with normal saline and antibiotic with intravenous fluid, and she is now complaining of sudden onset of acute severe left lower limb pain. We did an ECG and it showed that AF was a broad preventricular complex, and also we did ABG and showed metabolic acidosis with hypokalemia. We did arterial duplex and it showed acute limb ischemia. I'm calling for you, doctor, for an urgent transfer because the patient has acute critical limb ischemia.
All right. Please tell me, why do you think this case is urgent? Why can't you wait till tomorrow morning?
It's an urgent case, doctor. We need to save the limb. It's a critical limb ischemia.
Yes. And one sentence more. Early intervention can
Save the limb.
Yes. Very good. All right. Why don't you think, considering what you have told me on ECG, atrial fibrillation and preventricular complexes, why shouldn't you be consulting cardiologist first for a review?
Okay, doctor, we can consult him, but after the transfer and save the limb.
Okay. Right. Why do you think the patient's presumed diagnosis of diverticulitis?
Okay, she was first diagnosed with diverticulitis, but now we have AF and she has absent pulse. And now we are think of diagnosis of mesenteric ischemia as the patient is AF.
All right. So what are the other differential diagnoses you'll be considering?
Okay, we can think of mesenteric ischemia or diverticulitis or IO.
All right. Don't you think you should be scanning the abdomen first?
Okay, we might scan the abdomen, but the patient now is stable and her abdomen is lax, not tender, and she has no pain. So we can do serial abdominal examination, and yeah, she will be under conservative.
Do you think patient could have mesenteric ischemia because of the condition that you're telling me now?
Yes, it's one of our differential diagnoses, doctor. She has AF.
Are you going to consider doing CT scan abdomen for the patient?
Yes, we might do that, but after stabilization, her kidney function test.
So what would be your new diagnosis for this patient?
Patient, our mesenteric ischemia, we could think of mesenteric ischemia.
Yes, mesenteric ischemia leads to or occurs because of mesenteric embolus.
Yes.
All right. What other imaging are you going to do for the patient's acute limb ischemia? More than
Okay.
you've already done? Yes.
Okay, we have already done duplex, and we now can do CT angio or MRA after doing kidney function test.
Are you going to consider any anticoagulants for the patient?
Any what? Any what?
Any anticoagulants?
Yes, we can give her anticoagulant. We can give her unfractionated heparin, 18 ml IV as a bolus dose.
Why would you give unfractionated heparin and not low molecular weight heparin?
We can give her low molecular weight heparin,
Why?
1 milli per kg
Yes,
twice
which
day.
one would you give and why, please?
I will give her unfractionated heparin.
Okay, bye. How is the renal functions of the patient? Urea and creatinine and electrolytes?
I don't understand, doctor.
Have you done renal function tests of the patient?
No, not yet. Unfortunately, we didn't do that.
Okay. How are you intending to transfer this patient?
Okay, I would like to transfer her with an air ambulance, and if it's not available, we can go for an ambulance with blue light.
All right. Okay. What should be your plan of action as a whole for this patient?
Okay, I will start with a CRISPR protocol. I will start with
Yes.
high flow oxygen, and I will start with IV fluid, and I will start with managing the AF and treatment of the hypokalemia and the metabolic acidosis and the stabilization of the patient for definitive treatment.
All right. And if this management fails, then what measures would you take to save the limb?
Okay, we will go our definitive treatment. It may include thrombolysis or bypass or embolectomy or fasciotomy or amputation, of course, after consent of the patient.
So, how are you going to handle the relatives of the family, the families of the patient or the relatives?
I will discuss with your family about the benefits and risk we can get from this operation. And the patient, I will explain that the patient has an acute reduction of the circulation, and he will need an urgent transfer for intervention by a vascular surgeon. And the patient may have some complication which may lead to amputation.
Okay. Considering your new diagnosis that patient could have mesenteric embolus, what might be the cause behind it?
It's maybe due to the patient has AF.
Atrial fibrillation. Okay. All right. Who is going to accompany the patient?
I will go or an surgical doctor or and the cardiologist and anesthesia may go
Okay.
with him.
Right. Then you can send the patient over. Thank you.
Okay, okay. Thank you, doctor. Thank you for time.